Hi folks. First of all, thanks for all the positive comments. Very appreciative of those. Thanks for all the questions as well. First of all, I would like just everybody to hang in there. As you know, especially here in Ohio, this is crunch time the next week or two, early April, when we should be peaking, and then hopefully get through this and get back to normalcy. So this is going to take a while. I think the prediction is close to 100,000 cases, which is a lot, and that's coming soon. So we figured it'd be early April. We're in early April. The idea again is to peak and then stay level and then drop off. So anyway, hang in there, stay away from people, stay inside, wash your hands, don't touch anything. I think those are the golden rules. Okay, first question. Why aren't you closed? So I had a couple of business people recommend that we close and therefore decrease our expenses and our overhead because we're not very busy, and then reopen again once all this stuff blows through. That makes sense from a financial standpoint, that we could close, shutter everything, and then just open up again. The issue is then, what do we tell everybody? Who will you see for your care? And the only options are really emergency room and urgent cares. So it doesn't make sense ethically to divert babies and kids and families to sit in an urgent care or an ER, because you will not only be exposed to a whole population of sick people that have other infectious diseases, but also may have SARS-CoV-2, coronavirus. So it really doesn't make sense. Are we that busy that we can stay afloat financially? I don't know. But that's the state of affairs for every small business in the United States. So anyway, the answer is no, we're going to stay open. It doesn't make sense, medical sense, to close. It does financially. While we're not actively open, we're trying to see only those kids that we need to see, because we don't want to increase your exposure from even leaving the house. If we can talk things over with you over the phone, we're trying to do that. I know some of you folks have sent pictures in, which are helpful in making diagnosis at least, and help in treating. It's not ideal, but it's better than nothing. If you are coming in and you really need to come in, we're having you go from your car directly to the exam room, which has been cleaned with a bleach solution. There is no check-in or check-out. There's no waiting room. You're not going to have any contact with other patients. So the visit will not be drawn out. We'll try and limit it as much as possible, so you come in to get whatever's needed and get out. That's it. Next question. Okay, where can I get a coronavirus test? I mean, this is like the 50th time I've heard this question. Let's put things in perspective. There are about 11.5 million people in Ohio. I think the state-run lab did approximately 300 yesterday. So they're running about 300 a day because there aren't that many tests available to run. Those tests are just primarily for sick people who are that sick that they have to be in the hospital setting, and it's important to determine what they have. But it's not for anybody. Now, I know that there's some people that have wanted or have contacted private labs to get a coronavirus test or a SARS-CoV-2 test. You can do that. You can go through private labs, but it's not going to help you because the result will take at least 5 to 7 days. So why do you need to know the answer to that you're going to have to wait for a week? You can just stay in anyway. If you think you're sick and you're not sick enough to go to the hospital, put a mask on if you have to go anyplace, but otherwise just stay home. So there are not enough tests, so there's no reason to get one just for the heck of it. Okay, next question. Should I be wearing a mask? I know that's the trillion-dollar question right now. So I don't know how to answer that yet, because I think there is more data coming out that it may be helpful, but they're not sure. The problem is, let's just say you and I go out and we buy all these masks for ourselves and our families. There's already a shortage. That means that it will worsen the shortage unless there's this mass production of masks or personal protective equipment, gowns, gloves, all that. The supply just isn't there yet. So is there something else you can use if you really want to wear a mask? Can you make your own? Yes. Can you wear a scarf? Yes. At least it's better than buying all these masks, because it just won't help people. And I know you may not see it, I may not see it directly, but there are people still working in COVID-19 units. There are people in nursing homes taking care of the elderly that are using the same mask over and over again. It's contaminated. Or they're not even using a mask. And so other people have asked me, well, why don't these people just tell their employers they quit? They're not going to work here under those conditions. Because you need a paycheck. So if we're up to me, if I need a paycheck to pay my bills and help my family versus going under non-ideal conditions, I would probably still go in and do my job. So that's the answer to the mask question. It's really not an answer. And this is the last question. This is a kid's question from yesterday. Why are Pop-tarts so hot when you take them out of the toaster or microwave? Great question. I would like to consider myself a Pop-tart connoisseur of sorts. And I would think it's related to the bubbly filling, primarily of corn syrup, that gets so hot that you have to actually set it down. So I would recommend setting any Pop-tart after heating it on the counter on a paper towel, on a clean countertop, on a paper towel prior to consumption. Okay, that's all the questions. Keep them coming. I'm sorry I can't keep up with all of them. I'll try and answer questions more frequently if that's helpful. Please remember, there are very basic things we need to do, and that's stay home, don't go out, don't touch people, don't touch anything, wash your hands, and stay healthy. Thanks very much. Keep the questions coming. Bye-bye.